Hi, Dr.Z. Thank you so much for giving us more of your time to ask you some questions today. So good to be here. How are you?
I am doing okay. Thank you for asking. How about you?
I'm doing good. I know with the return of school and all the new things that are going down the pipeline of life with back to school, I really got to thinking about the difference between social anxiety and a child just being shy. So I am curious what the difference is between social anxiety and shyness. How can we tell the difference between the two? And is there ever an instance where social anxiety is a mental health disorder, but can it also be considered a natural response to certain situations?
Thank you for asking that question. And as in my previous videos, I always remind our audience that there is a difference between a symptom and a diagnosis. Just like chest pain is a symptom and heart attack is a diagnosis. So not every chest pain is a heart attack. Similarly, in psychiatry, in mental health, we have some symptoms, feeling shy, feeling anxious, feeling nervous, having heart is racing, about feeling that I am about to pass out, a world is about to end. So these are all symptoms itself. But I have seen people labeling it as a disorder and then providing the treatment. So that is the first thing as a parent, as a clinician, who need to remind ourselves, is it a symptom or is it a disorder? So the next question, the next thing that you ask is, so what is a disorder then, and what is a normal? Like, how do parents realize that when they need some additional help? So let's say the child, happy, healthy, eating is okay, sleeping is okay, academics, things are going okay. And then, but in certain situation, the child have these moments where the child struggle, get, more withdrawn, doesn't talk, or may seem, more scared or nervous. So those are, the some of the clues that the child may be having difficulty in those situations. That situations could be when they are around big gatherings, when they are around people they don't know, when that could be around in a play area, that could be in public speaking, that could be, they have to perform, that could be on a playground. So there are so many situations that could be, and sometimes it's pretty normal that kids, they have that anxiety, that worry, that I'm not going to do well, I may pass out, or they start hyperventilate. But if those symptoms are, or those, the symptoms are only in that situation, and despite those situations, the child is able to go there, it may take some time for them to adjust, but they are able to have some fun, maybe not as much fun as they have in situation that they are pretty familiar. But when they are over with that situation, they are having happy, enjoyable life, they are have a lot of activities. So I would say those are pretty normal shyness, pretty normal social anxiety situation. That doesn't mean that we just let it there. We definitely want to have that conversation with our children, when they are, a little bit calm, or when they are, at night, bedtime, how we can help and support them. I'm not saying, because this is just a normal symptom, you don't intervene. We do intervene. And we will talk about soon about that, how to intervene. But let me just go. So then what is an anxiety disorder? So when these symptoms of feeling nervous, feeling anxious, heart is racing, I'm about to pass out, and I'm not able to do well. Those thoughts are so strong that even before that situation, like a week ahead of time, you are having these thoughts, to the point that you having difficulty paying attention in your homework, you're difficulty paying attention in class, because those thoughts are just overwhelming you. And because of those thoughts, you may have difficulty sleeping, you may start getting nightmares. Oh my god, I am in that game, and then something that's really bad happened, and everyone will start making fun of me. Or you start isolating yourself, you start becoming more angry, more irritable. So if those things are happening, let's say ahead of time, and it's impacting to your day-to-day routine significantly, then that's where we call this is a disorder and definitely requires further professional help.
Thank you so much for that. It always is so helpful to have it explained. And you have such a way of explaining things where it's easier in a way to understand as a parent. I'm struggling with the word here. It's like it's easy for me to receive what you're saying and I can understand it. So thank you for answering that question so much. And as always, we always appreciate your time.
I'm glad. Thank you so much for having me.